Dr. Professor P.C. Manoria, Executive President, 4th World Congress, CKM, Mumbai, Hotel Leela, 18th and 19th April 2026, with Dr. Peter Schwarz, who is the President, International Diabetes Federation and a globally renowned diabetologist. Dr. Peter, we are amidst an era of new diabetes care. We have a panoply of new anti-diabetic medications, but these medications, no doubt, they improve glycemic control, they improve the quality of life, they decrease morbidity and mortality, particularly the two new innovative molecules, SGLT2 inhibitors and GLP, but they do not decrease the number of diabetic patients. The number of diabetic patients are increasing rapidly, and we have colossal figures every time the prediction is made. So what can we do to prevent diabetes, particularly with reference to the Indian context?
Your statement had numerous aspects which I would like to address. One is, why is the number not decreasing? And I clearly would say we come too late. The physiology of diabetes development is a dysglycemic continuum. And before hyperglycemia starts, we have 10, 15, 20 years development of insulin resistance and so on. And then if hyperglycemia starts, sometimes it takes still 10, 15 years until diabetes is diagnosed. And this is a problem. Even with all the good treatment opportunities we have today, the number will rise in the future. And it's not because we fail with the diagnosis, it's because the risk factors for the disease, obesity, insulin resistance, physical inactivity, eating a lot of fried carbs, this increases globally a lot. And then you have asked, what can we do for prevention? And this is, at the end, means addressing this risk factor as early as possible, not waiting until someone has hyperglycemia, starting much earlier, starting at the stage of obesity. But something, what is very new, what is very actually is fatty liver disease. The WHO in the last week had a consultation about fatty liver disease, which is, in my eyes, the underlying determinant for the development of diabetes. And addressing fatty liver disease, addressing physical inactivity, addressing the high consumption, especially here in the region of fried carbs, addressing these risk factors could be a way for diabetes prevention. And there are some new information and new studies also, including fasting protocols into diabetes management, could be also a new opportunity for diabetes prevention.
So what is the magic of this fasting? What does fasting do? Can it extract fat from the liver? Can it decrease fat deposition from the pancreas? What does it do?
You already gave the answer. And to make a long story short, if you stop eating, glucose is going down, insulin is going down. This initiates a glucagon release, and glucagon breaks down glycogen in the liver for 2 days, then starts a kind of autophagy, breaking down protein to make glucose out of it, but it's not muscle cells. And then also the hormone glucagon starts the beta oxidation of fatty acids. So it's breaking down fat to make, at the end, ketone bodies out of it. And the simple answer is, where is glucagon? It's in the pancreas and in the liver. That's why these two organs, by fasting protocols with high glucagon level, are freed from fat. So the fat is broken down in the liver, in the pancreas. They are become fat-free, we could say. And this is the fastest gain of health we can generate. Why is this so important? Because we know that if we are in a stage of overnutrition, so eating 100, 200, 300 kilocalories more than we use per day, this leads to accumulation of fat in the liver, especially in the conjunction of consumption of of fried carbs. If the liver accumulates fat, the liver gets insulin resistance. This leads to release of fatty acids from the liver and release of glucose from the liver. So it's increasing glucose. And the second organ is the pancreas. If the fatty acids come out of the liver, it starts accumulation of fat in the pancreas, and this initiates a subclinical inflammation in the pancreas. So now we have an insulin-resistant liver and an inflamed pancreas, and this is the determinant for diabetes development. By fasting, we can break this circle. And that's why I think there is a good opportunity for fasting becoming a part of diabetes therapy and diabetes prevention in the future. And as president of the International Diabetes Federation, I have initiated a group collating all this evidence, and in April next year, on the next World Diabetes Congress, we will issue a guideline on fasting and diabetes, addressing 19 different fasting styles for diabetes management.
The pathophysiology of diabetes is very well understood at the present time. But what is the problem in implementing it at a mass level?
I would actually say we only believe that we understand the pathophysiology of diabetes very well. There are a lot of new information. Yeah? For example, the use of glucose sensors has told us that the pathophysiology of diabetes is different than we expected. So I think we should be very open that there's new information also coming in the future. And for example, we see with all the new drugs that they are so efficient, yeah, that we have learned a lot about pathophysiology of diabetes in the last 10, 15 years. I would not say that, to the second part of your question related to diabetes prevention, that it's difficult because of pathophysiology. It's difficult because of our lifestyle. If I am allowed to give a European example, if we compare the European population today and 100 years ago, we eat about 10% more than 100 years ago. So it's a little increase of consumption of food. The quality of food today is much less than it was 100 years. But the significant change is we are only physical active to about 18% compared to 100 years ago. And this generates a big gap. So we eat much more than we use per day. And basically, this is the overnutrition. But we can criticize it. At the end, it's our lifestyle. And this is a problem with diabetes prevention, that we have to change the lifestyle. And changing lifestyle is changing a habit, is changing rituals. And this is always difficult. And this is the barrier. But fasting, again, could be an opportunity because it's a fast change of lifestyle. But also new strategies using AI and digital technology can help to motivate to change lifestyle. And these are the strategies for diabetes prevention. If we are here in the region, I would recommend, if you want to change only one thing, then I would say don't eat fried carbs. And I see you smiling because it's part of the diet here a lot, much more than in Europe.
Very tasty in the Indian context.
Yeah, very tasty because it's fried carbs. But skipping this immediately increases your health.
So what is the role of microbiota and how does fried carbs or artificial sweeteners or diet coke, which used to be very prevalent, affect these microbiota? And what is the impact on diabetes?
So the microbiome, I would say, is one of the largest organs we have in our body. And you mentioned the artificial sweetener. There are 38 artificial sweeteners available worldwide, and 36 of them change our microbiome. So if you exceed a certain threshold of artificial sweetener per day, and 1 can of soft drink containing artificial sweetener is enough already, 1 can per day. So if you exceed the threshold, it changes the bacteria in your gut. There are 14 different bacteria invading your gut. And the bacteria are not the problem. Yeah? They help us to digest. It's not harm, it doesn't hurt. But the bacteria produce metabolites. It's basically the stool of the bacteria. And these metabolites are a glucose molecule bond to fatty acids, very stable. And then this is in our gut. And we incorporate this, we take it into our blood. And the body cannot break it down because it needs a lot of energy to break it down. And the body stores it and stores it in the liver. So the change of microbiome by artificial sweetener at the end makes MASH or MAFLD, so fatty liver disease. And interestingly, this glucose molecule with the fatty acid, which is generated by this bacteria, it's the same what we generate if we fry carbs at a temperature of 130 degrees. The same molecules are combined. So both fried carbs and artificial sweeteners support a very fast development of fatty liver disease.
So this diet coke is also so bad.
Yeah, now you use the name of the product. Yeah? It's the diet coke is exactly the problem. But all the diet products containing artificial sweetener, Coke Zero, all these energy drinks you find, everything where the industry is written on it's glucose or it's sugar free, but it still tastes sweet because of artificial sweetener.
So what simple 1 or 2 line message for the physicians, practitioners for prevention of diabetes?
The first thing I would say is education, 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 because also we as healthcare professionals, we are very much focused on the things we do on a daily basis. So educate yourself that pre-diabetes is a window of opportunity to prevent diabetes, to prevent cardiovascular outcome of the patient. But we have to learn it. So education is one of the important steps. And then at the end, it's lifestyle change. And there I would argue for 3 things. And one is skip artificial sweetener, be physical active, walking 10,000 steps a day, or any other physical activity. The muscle which is used protects your health. And thirdly, think about a model of fasting for your health, or fasting away the diabetes. But at the end, it's prevention, 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 what we as healthcare professionals should incorporate in our daily work.
Thank you very much for your very interesting and educative takeaways for prevention of diabetes. You are a man of prevention, prevention, and prevention.
Thank you very much. It was an honor to talk to you.